I think the first question you're likely to come across in an interview is simply, why do you want to be a doctor? What are the reasons that you want to be a doctor? And you need to give this a lot of thought and go well beyond the sort of obvious answers, such as, I like chemistry. Because even if you love chemistry, at an interview they're going to ask you, well, why don't you just go into pharmaceuticals? Or if you really love chemistry, why do you want to be a researcher? Because a doctor has to be someone that doesn't just love chemistry and is naturally talented in the sciences, but also who has a lot of people skills and who enjoys working with people. Another common answer students will give is that they want to be a doctor because they like helping people. And you need to really be able to explain and articulate why your desire to help people fits in with the medical profession. There are lots of careers you can go into where you help people. It can be working with students as a teacher, it could be working as a psychologist. So there's a lot of other professions besides just medicine where you're going to help people. I think if anyone says that they want to be a doctor because of their parents, or they want to be a doctor because they have an uncle who's also a doctor, that's a really poor answer to give. Just because your parents are successful in a field doesn't mean you're made to be in that field. Trust me on that one. My dad's a physician, and I never felt that I had the skills to be a doctor, and I certainly never wanted to be a doctor, and just because he was a doctor didn't make me appropriate for that sort of career.
So students going for any interview, not just for medicine, veterinary and dentistry interviews, but for any interviews, communication and the communication skills demonstrated are going to be very important. And that's not just during the interview itself, but it starts before the interview. It starts in terms of how students respond to email invitations, and it starts in terms of how students even enter the interview room, how confidently they come across. If you've got a number of interviewers, that you are looking around at all of the interviewers, eye contact is very important. And part of it also is maybe not rushing through your answers, but taking your time, thinking before you speak. All of those things will add up to a person who has the communication skills that the university will be looking for. Another important aspect for students who are very proudly telling universities and particularly medical schools and veterinary schools and dentistry schools about the work experience they've done is actually how you can talk about what you did in that work experience. It's being able to reflect on the experience itself. So when it comes to doing your work experience, you're not just ticking boxes so that they will say, oh yes, they've done that work experience, but you are thinking about particular things that have happened during that work experience. So for instance, doctors, you need to be able to talk about particular patients. You need to be able to expand on the illnesses that you saw or the syndromes that they were suffering from, and you need to be able to explain those in relatively straightforward, simple terms. So think carefully about how you are going to talk about your work experience.
Okay, so one of the things I think your interviewers are interested in is having a sense that you understand the nature of healthcare provision in whichever country or countries you're gaining work experience in, or the country that you hope to practice in, and certainly the country where you intend to study your medicine course. So, for instance, if you're intending to apply to the UK to study medicine, then you should definitely be familiar with the National Health Service in the UK. Think about questions concerning the pros and cons of that healthcare provision, the kinds of criticisms that might be made about that system, and your own opinions about it. But equally, if you're thinking about practicing somewhere else, that could be your own home country, you should definitely be familiar with your home country's healthcare provision, the differences between public and private kinds of healthcare provision. Possibly think about how healthcare insurance works, medical insurance works. And also something that's worth thinking about is that if you have gained your work experience in, let's say, a country that's very different from Singapore, a developing country, say India or Cambodia or something, you should be engaging beyond simply the actual work experience that you had for the week or two that you spent there, but think about the nature of public healthcare, public hospitals versus private clinics. Think about larger questions of people's access to healthcare based on their economic circumstances in that country.
Well, I think it's likely that they're going to be asked some questions about how they would manage on a team, because there's a great deal of team play involved in medicine, and that team could be comprised of all the different individuals who are involved in healthcare, the nurses and so on. But that team is also made up of the patient, who's kind of at the centre of it, and who also has to be, you know, kind of a collaborator and a contributor in their own healthcare. So I think it's important for kids to think about where the doctor fits into that team. First of all, the doctor is not really going to know all of the answers at the beginning. So a junior doctor is going to be arriving in a hospital, and some of the other people who you know, might be considered to be in less prestigious roles might know a lot more about the running of that hospital. So you need to think about how you're going to work with the nurses on that ward. You need to think about how the patient's own knowledge needs to play a part. How are you going to inform the patient, respect the patient's decisions, kind of you know, help the patient to understand different options available to them, and their own responsibility in that to be informed. So it's really about relationships. So students need to think about how they have managed on a team. What do they do when they're on a team at school and there are people who perhaps are not playing their part? How would they deal with that? How would they negotiate with those people who are not working effectively? If they're leading a team here, if they're leading a global concerns or some other kind of team, what does that leadership mean to them? Does it mean that they just get to kind of sit at the top of the hierarchy and be the big boss and tell other people what to do? Or how do they actually support other people in their team and help them to be effective?
Another thing that students should be prepared for as they get ready for their medicine interviews are to consider how they would react to different scenarios that are presented to them by their interviewers. So if, in an example, how would you react to a particular patient that comes in and asks for this, this or this? Or if you were working in a hospital and you observe this scenario, how would you react? What things do you need to take into account? And the things that they're really looking for there are, do you prioritise the patient's welfare? That should be your first priority. Are you aware of whenever any legal implications may come into play? As a doctor, you are not allowed to break the law. So they're not expecting you to know all of the laws, but they're expecting you to recognise when that may become an issue and how you would respond there. And the third thing that they're often looking for is whether or not you are aware of the issues of patient confidentiality, which is a very important aspect of the doctor-patient relationship, and there are very strict guidelines as to when that can and cannot be broken. And again, they wouldn't expect you to know the strict guidelines for each of the countries, but they'd expect you to know that that's an important aspect of the relationship, and that if you're getting close to any scenarios where you might have to breach that confidentiality, that you would have to be sure that you are operating within the guidelines set down by your professional body. So scenarios are an important aspect of your interview, and you should certainly spend time looking at different examples of those before you go for your interview. There are lots of examples in a number of the books that we've got in the office here, so that's a great way to spend half an hour as you prep for your interviews.